Hi everybody, welcome to my channel. Today we're going to talk about depression and anxiety during pregnancy. I'm Rita and today it's all about you. The myth that pregnant women have to be happy is still prevalent. And this is why most of the healthcare providers doesn't really address this problem to pregnant women. On the other way, pregnant women and women in general still feel ashamed about their own mental health state and they don't really bring it in. Health providers in general has to be aware of this fact in order to not just take care of the health of the mother, but also to take care of the health of the baby. Helping the mother dealing with their mental health state during pregnancy is also helping the family dynamic. Nowadays it's very common to look at the mental health state of the mother after birth, but during pregnancy is also very important. During pregnancy, it's not very easy to identify signs and symptoms because of the normal symptoms of the pregnancy itself, like the change in appetite, changes in the energy level, mood swings, concentration, sleep, and so on. But for instance, during pregnancy, if a woman is feeling too much sadness, depression, feeling always down for a long time, that can be a red flag. Also, not really enjoying things that usually the woman used to enjoy, not really feeling happy and not really feeling fulfilled with some activities that usually give this kind of feeling, it's another sign. The decreased interest in the world that surrounds us, even a decreased interest in the baby, in the things related to the baby, or in any other things related to the people that surrounds the woman, the family, the partners, other children, and so on. The same mood swings, lack of appetite, lack of sleep that a normal pregnancy usually brings, but also suicidal thoughts. These also are all signs and symptoms that the mental state of a pregnant woman must not be okay. In terms of anxiety, it is very common. Symptoms like irritability, muscle aches, fatigue, poor concentration, compulsive thoughts, and of course panic attacks. But suffer from depression or anxiety during pregnancy, it can be actually common and not really give us a red flag, but at the same time we have to understand that can have or can happen things that are risk factors. Like if in the family there's a history of mood swings, or if the person has already a certain history in the past of mood swings, this can also be a trigger for something that can happen just like that during pregnancy. People that suffer from premenstrual dysphoric disorder also can have much more signs and symptoms during pregnancy, particularly associated with anxiety. People that usually live alone or have family conflicts or have a poor social support, had some traumatic experiences in the past that can bring some symptoms during pregnancies, particularly and especially if these traumatic events are not really deal with, or if the person didn't cope with. Having a low income or having other pregnancies problems in the past. The consequences for an untreatable depression or anxiety problem during pregnancy are very important, particularly because of the child. There is a big risk of a premature birth, of a low birth weight, of a low APGAR score in the beginning of the baby's life, or even poor adaptation to the outside womb. To the mother, the complications can be, or the consequences can be even harder because includes suicidal thoughts and suicidal tendencies, a very high risk of postpartum depression, the use of substances, especially in the anxiety cases, preeclampsia, and even the basic things of not taking care of themselves and not taking care of the baby. But the main problem in the treatment of depression or anxiety during pregnancy is medication that usually are effective. They most of the times cannot be taken during this time of life. Medication effects to the baby is really strong and can really bring a preterm baby, can cause autism spectrum disorder in the baby, feeding issues, and issues about the normal development of the baby in the womb and outside after the birth. Many mothers and doctors, of course, prefer to enroll themselves into a psychotherapy, into talk therapy, as well as taking some special vitamins like omega-3, essential fatty acids, even light therapy or acupuncture. And all of these together can help alleviate most of the depression symptoms. In a general way, women in pregnancy, they can help themselves to fight these early symptoms of depression or anxiety. And the best way is to talk about your feelings to family or to friends that are someone that you trust. Practice some breathing exercises that help you to relax in a physical and mental way. Do some physical exercise adapt to the pregnancy. Eat and sleep in a much more healthy way, and attend antenatal classes, not just to learn stuff about the baby and how to take care and how to deal with certain stuff after the birth, but also to meet new people, particularly people that are also pregnant just like you. Try to avoid to compare yourself with other pregnant women. Each person is totally different, and each pregnancy is totally different from one another. Talk about your feelings to your healthcare provider. Don't be ashamed of things that you are feeling and thinking, and talk about it to a professional. Do not drink alcohol, do not smoke, do not use any kind of substances, because all of these can really affect the growth of your baby. And avoid negative, toxic people is very important, because this doesn't really help, or this kind of people doesn't really help you, and they don't really understand what you are going through, and the best thing is to avoid to deal with these people. Being pregnant is a big life event for any woman, and it's natural and normal that you feel many different emotions that you never felt before. But if you are feeling sad, and if this sadness are affecting your daily life routines, remember that you are not alone in this. Remember that you are not different from any other person, and remember that the first thing that you have to think when you think about taking care of your baby is know how to cry for help, or know how to ask for help. So talk to your healthcare provider about your feelings, your thoughts, and probably together you will find the best way to deal with all of these things without affecting your health and without affecting the baby's health too. And that's all for today, guys. I hope you like it. I hope you subscribe to the channel, leave a thumbs up, share with a friend, comment if you want, and I'll see you next time for another video. Bye!